Hi, this is Pete Fernbaugh. Welcome to Trinity Talk. And our guest this week is Dr. Vincent Kolenich. Dr. Kolenich, what is your specialty?
I'm a podiatrist.
Okay, so you're into podiatric medicine?
Right.
So for the lay people among us, myself included, what does that mean? What does that involve?
So podiatric medicine involves the diseases and illnesses and the treatment of those diseases and illnesses of the lower extremity, the lower leg, and the foot and ankle.
Very good. So we're into the summer months. It's hot out. People are on vacations. All sorts of activities are going on. What are some of the common problems people bring to your practices?
Yeah, we see an increase in sprains and strains as people get into doing different activities in the summertime. They'll injure themselves and they'll come into the office with sprains, strains, fractures, sometimes some infections, ingrown toenails, things like that that are seen more frequent as we increase our activities.
Excellent. So what is the first piece of advice you give them for preventing those things?
Really, the answer is prevention, and proper shoe selection is the key. So like if you're going to go on a hike, you want to make sure that you have a good sturdy shoe, preferably one that laces up, versus wearing a flip-flop or something like that on the hike. So it's important that you select the proper shoe.
So what are some good makes of shoes?
Well, I always tell my patient, the best shoe for you is the shoe that fits your foot the best. And it doesn't have to be a particular brand, it's just that the type of shoe has to fit the activity that you will be participating in.
Excellent. Water shoes, great idea. I don't think about that myself. What about going on a hike? I like to hike, so which?
Sure, you want to wear something that is properly fitted to your foot. And it has to have ankle support, and it should be lace up. Try to avoid any type of an unstable boot or shoe. One that's too big or one that's too small will only cause problems. So you have to prepare for your hike before you go on the hike to make sure that your shoe fits properly.
You've mentioned ankle support. Could you elaborate a little on that?
Sure. When you're hiking, you're on uneven surfaces. And the way that the foot and ankle are connected to each other, there has to be some stability. Our muscles and tendons provide that for us. But when we're doing something a little bit more strenuous, we want to make sure that we have extra support.
What are some warning signs that a person should see you?
Sure, pain. We experience pain, and that is a warning sign to tell us that something is wrong and we should seek help. And so I always tell my patients, if you have pain, redness, swelling, you smell some type of an abnormal odor, that you need to call your podiatrist.
I didn't realize an odor could be a sign of
Sure.
Could you elaborate on that?
Infections, both bacterial and fungal, can have some type of an odor that can be used as a warning sign.
We get a lot of information on the internet, which must drive you nuts as a specialist.
It can.
What are some common myths people believe about footwear and about the problem?
Over the years, practicing podiatric medicine, I've noticed that patients will come into the office and say that, they have foot pain. And not only do we look at their lower extremity, and we look at the shoes that they wear into the office. And unfortunately, sometimes the shoe may look perfectly fine, but it's either not the appropriate shoe for the patient, or the shoe is just too old. It's worn out. It's served its purpose. And sometimes something simple as changing into a new shoe can alleviate the majority of the patient's problems. So, that's one myth. People will say, my shoes look fine, but really they're not, and they need to replace the shoe.
We've already covered several things people can do to prevent problems. Are there any other tips you can give us about keeping our feet comfortable and healthy?
Every day, you should look at your feet at least once a day. If you're doing increased activities, anytime that you change your shoes and your socks, look at your feet. And if you're unable to look at your feet, have somebody else look at your feet, especially if you have a disease process, such as diabetes or poor circulation. So an ounce of prevention is worth a pound of cure. If we can catch the disease process early on, we can eliminate the amount of recovery time that you might have by treating the problem quicker.
So being alert, early prevention, all that just typical advice that you give for our health. Is there anything else that you see on a daily basis in your office that you would like to tell our community about, that you'd like to warn us?
Here's the most important thing. It's better to take care of the problem in its early stage than it is later on. So for instance, if you sprain or strain your ankle this summer, or worse, don't think that it's going to get better on its own. It might, but then you may have things down the road that could have been eliminated if we would have treated your problem sooner. So it's very important that you seek the advice of your foot and ankle specialist.
Okay, so you've given us a lot of helpful tips. You've given us a lot of great insights into how we can be safer this summer. What else should our community know about seeing a podiatrist?
Sure. You know, our feet are our foundations for our entire body, and it's very important that we take care of our feet. And it's better if we take care of problems before they become too advanced. And the key to that is to make sure that you see your podiatrist on a regular basis.
And at what age should you start seeing a podiatrist?
There's really no set age. Everybody should see their foot and ankle specialist, should see their podiatrist on a regular basis. Just like when you see your eye doctor once or twice a year, your dentist once or twice a year, you should also see your foot doctor at least once or twice a year.
Thank you so much for watching. We'll see you next time.